there, everyone. Welcome back to another episode of the Female Empowered Podcast. I am your host, Christa Gurka, and today's episode is why I really believe that care management is the future of physical therapy, not selling PT visits or individual sessions or even packages for that matter. I have believed for a long time that physical therapists were taught to trade time for money. And I believe that does our industry, our profession a disservice. I think it also does our patients and our clients a disservice. So if you think about it, if I'm a good enough therapist, and I am, to get you to get the same results in 15, 20, 30 minutes, then why should I charge less than someone who takes an hour to get those same results? I'm saving you time, which is valuable, and time is money, especially for a lot of people. So today, what I'm actually going to really talk about is how to transition your marketing, your branding, your positioning, and selling care plans, care management, and how to actually sell it versus individual plans, individual sessions, or even packages. Okay. So a lot of people that I talk to, especially in our mentorship programs, talk about not usually the owners, but a lot of times the staff is uncomfortable selling longer packages, long-term plans. They're uncomfortable talking about care management, okay? The whole shebang. We all know as therapists or movement professionals that it takes more than a couple sessions. We all know that sometimes the benefit of working with someone, a physical therapist who is as knowledgeable as we are, is that we can talk about preventative measures, we can talk about program design, some people can talk about nutritional components, we can talk about sleep patterns, we can do the hands-on care, and we can also develop continuity of care in terms of programming and making people even better than when they came in. So I want you to consider that care management or care plans isn't failing because your patients don't want it. It's really failing because most physical therapists are trying to sell it a package, right? Not positioning it as the overall solution. Here is the overall solution to your problem, right? And today I'd like to walk us through just something for you to consider and how you can maybe transform your practice, your clinic, your business in 2026. So we're going to talk about who care management is for and who it's not for, because there are still some people that just need one-off visits. That's fine. Why that really actually matters as well. How PT already competes in the care management infrastructure without really realizing it, and how to design an offer that makes this model not only ethical, but clear and easy for your patients to say yes to. Because ultimately, it's about showing them the transformation that they are going to get and for them to be a no-brainer. Yes, this is really what I want. Okay? It's not about forcing patients to do more visits. It's about explaining to them the entire plan and ecosystem of how you as an amazing therapist or your business specifically can provide for them, right? It's about helping the right people stop navigating their recovery on their own or just listening to YouTube or any of that stuff, okay? So one of the reasons I think it's hard to sell, and I think I don't know, maybe it's an uncomfortable truth, but I think PTs, especially newer grads, are really hard at selling because PT school doesn't really teach you how to sell. Everyone is selling something. We are creating a transformation in people that allows them to save tens of thousands of dollars on surgery, that allows them to save tens of thousands of dollars on PTO or medical leave or any of that stuff, okay? It feels hard to sell for a lot of PTs because we were taught treat them and street them, right? Pain shows up, PT happens, pain gets better, care stops. That's it. I think that's an old paradigm. But that model that we were taught in PT school doesn't match, and we know this now, how bodies actually behave, especially not for active adults. Pre and postnatal, pelvic health issues, aging athletes, people with recurring and repetitive injuries, okay? So when PTs are trying to sell the maintenance program, what the patients hear is, okay, so I have to do more visits, more money, but I'm not going to get any better. I'm just maintaining. And that's not really what a care management plan is. It's not, okay? It's different. And so the mindset is different around that. And I think that's what's really hard for people to sell, and even for patients to grasp when they're, okay, you're discharged, but let's go on the maintenance program and you're going to get charged the same. For them, they're like, well, my pain's gone. Why do I come back? Pain management is not necessarily a maintenance program. It's not a longer plan of care. It's actually a different lane for you to present to people, right? And I said, it's not necessarily for everyone. And the moment we can accept that, we can get clearer and easier on who it's for and who it's not for. All right. It's not necessarily for very specific programs, but it's injuries. It's more specific for layered programs, layered industries, layered issues and challenges. So for example, I just tweaked my knee yesterday, and it's a person and they did necessarily, you see them, they tweak their knee, they need 2 or 3 visits and they're going to be fine. That's great. Those people can get here. I think you'll get better in 3 sessions. Here's what we want you to do. Come in 3 sessions. Here's the cost. Move on. Okay. It's not necessarily for those kind of people. Think more around pelvic health issues that also come with severe stress around maybe their relationship, or pain with intimacy, or back pain that has been around for 10 years and you're noticing that their ankle doesn't move well and their hips are not strong and their thoracic spine and neck are impaired. And so this is a very layered issue. It's not just that they have a herniated disc at L5S1, or athletes that suffers repetitive injuries and overuse injuries, athletes that are continuing to have plantar fasciitis. And you see that it's not really the ankle and the foot, it's really coming from the hip and low back instability, right? And so those are layered problems that require a different and should be offered a different solution, okay? These are not necessarily people that need a quick fix. They need ongoing interpretation of what's happening, because once you peel back one layer, then you go and usually fix something else, right? These people have certain patterns that keep showing up that keeps causing these injuries to come back. And that's what we're fixing. We're changing people's patterns, and that is more of a care management plan rather than just a one-off, we're going to get the inflammation out of your ankle sprain, okay? Think of the people that come into your clinic that's every time I go to a hotel and sleep on a different bed, the pain flares up again. Or I've done PT before, but it keeps coming back. Or I've done PT on my plantar fascia and it's the 7th time I've gotten it this time. Or maybe they're not being consistent with their home program and their pattern readjustment. They don't trust themselves to progress safely. They are not good at doing their home exercise properly because they don't have the right proprioception and awareness that they're doing it the right way. They're always Googling their symptoms. Oh, my foot hurts today. My knee hurts tomorrow. This care management, what it does is it reduces decision fatigue for your clients, and that alone is value. Work with the expert, get there faster, and have longer lasting results. Right? So you really want to also position it in a way that it's bringing on prevention and mitigating future injuries. So people that are, I don't want this to get worse. I notice that it's getting worse. I don't want to go through this again. I want to stay active long term. I don't want to have to stop running. What they're buying from you is future stability, not today's relief. So take someone who has just had a baby. Maybe now they get pregnant again. They don't want to have the same issues they had with their first pregnancy or labor and delivery. So someone that's going to have transformation for 9 months, a care management plan is really what's best for them versus individual sessions, okay? So those are the things I want you to think about. the model of that type of plan is not for everyone, and that's very intentional. And I think that's what builds trust when you talk about it with people. So we have two different options. We have a care management plan for some people. That's not for everyone. So I really just want to make sure where we are and if you're better suited for the care management plan or for one-off sessions, okay? So if you want to compare it to other people that provide care management plans, chiropractors do, okay? Primary cares do, right? But primary care doctors, physicians don't have the ability to program design and put hands-on care. Chiropractors don't, not all of them, but most of them don't do follow-up and programming. Not all of them, but a lot of them don't do resetting of patterns. Not always, okay? Even Pilates and yoga, it's great, but most Pilates instructors, if they're not PTs, can't do the manual work and the soft tissue work and that kind of stuff. So physical therapy is one of the only professions where you can manage the pain, unload, and then reload. You can manage adaptation, you can manage progression, you can do it together. And that's what fills the gap between injury, especially recurring injury, and true transformation, which is this not coming back in the future. Okay. So how can you, as a physical therapist or as a physical therapy business owner, help your team become seen as a care manager? Okay. It's not just about exercise prescription. It's about interpreting their movement patterns. It's about progressing them in a correct, developmental, movement-based, neurologic way, motor planning, etc. It's about guardrails and course correction, okay? So you want to present yourself as not just the person that treats the pain, you're the person who helps you decide what your body needs next. Okay, now you deal with the pain first. Now what are we trying to do, right, in order to get you so that pain doesn't come back again? Most of you that listen to this podcast, most of you that own these businesses, you want to get to the root cause of the problem. You want to look at the body holistically. I hear this all the time. You're amazing practitioners. What some of us have a hard time doing is just selling that to people. We're not selling visits. We're selling a plan of care. Okay. So we're not talking about it as ongoing PT. We're not talking about it as maintenance. We're not talking about it as more sessions. We're talking about it as guided recovery, progression, support. Okay. And also offering things, decision-making help, right? A lot of people go home and they go, I don't know if I'm doing this right. That is part of a care management plan. Okay. Most people, I think this is a really good selling proposition when you talk about this, is most people don't fail PT. Their support stopped too soon. Okay. You don't need more exercises per se. You need someone who knows how to change them when it's necessary. You need someone who knows how to reload you. You need someone who knows how to deload you, right? You want help knowing what's normal, and I can provide that. Okay. You want help knowing when having someone keep an eye on you, right? It's one of the reasons in our Pilates studio was so successful is because we had physical therapists teaching classes. And so a lot of them were, oh, that's my PT. They can watch me in this class. And it was a unique selling proposition. And that's what we used to include in our whole care management plan, right? We were selling how we can have patients forever. And we don't call them patients. We actually call them clients, because I think patient involves somebody thinking that they're always injured or they're always hurt, right? So what we tried to sell to people was, you don't have to recover alone. You don't have to be alone on this journey. We will walk alongside you and help you create an entire program and ecosystem from which you can not only recover from injury, but thrive in the future. All right. So let's talk about what that looks like. Let's talk about what selling a care management plan versus a package of visits actually looks like. So I always think you have the one-off sessions. Okay. You can call them things one-off clarity sessions or one-off introductory sessions. And so those are self-directed, acute evaluations where people are really just looking for some reassurance, right? Some immediate results, somebody that needs 2-3 visits. It's 60-minute assessments, maybe 2 or 3 visit follow-ups, okay? This is for people who want answers now, not necessarily ongoing support. So they want in and out. So that's where you can have your evaluations plus 2 follow-ups. You can have your 4-session packs, something that, okay? The next offer tier is where you start getting into, again, a care management plan. So you can call it something guided recovery or transitional support. This is more short-term care. This is for people that have a clear issue, they have a defined goal, and they have a time-bound recovery period that they want to get better in. Okay, so you do an evaluation, you're going to recommend that they do this guided recovery or transitional support, and they're going to have 4 to 8 visits, somewhere between 6 and 10 weeks. So you're talking about maybe 3 months, maybe 6 to 12 weeks, and it's goal driven. Okay. Their exit plan is already scheduled from day 1. And this is for people who want focused help and a clear endpoint. You have 3 months. We're going to bill you monthly for this. It's probably going to be 4 to 8 visits, somewhere between 6 and 12 weeks. Okay, we'll structure those, and it's going to be a monthly fee of this. They get their visits. Maybe they get some Voxer support to the PT where they can send follow-up videos or questions, etc. Okay, so that's the middle tier. Now, the highest tier would be a whole care management oversight plan. So something where it's continued support or I'm blanking on names now, but things that you can call it for this. This is the highest tier program. So this is for people that have complex, pattern-driven, prevention-minded clients. Think of an athlete, a CrossFitter who really wants to learn why that shoulder pain continues to come back, and they're bought into saying, I am going to improve the patterns in my body that keep me from doing the things I want. Or marathon runners, or prenatal birth plans, those kind of people, or even your active ager in their 60s. It's, I want to stay active into my 70s. So how can I make sure that I'm able to do that, right? This includes you're getting the evaluation, you're getting your initial care, which might be to decrease the pain, to mitigate the pain, etc. You're getting monthly visits, maybe every other week. And then you're also getting access to your clinician, whether that be through Voxer. And again, you can say that it's between the hours of 9 and 5, Monday through Friday, whatever that is. But the value of being able to reach out to your clinician and ask a question or share a picture or say, this looks swollen, does this look normal? I pay a premium to my actual PCP for that access to be able to text her questions. And I can be, my ankle is as fat as I don't even know, I can't think of an analogy right now, is huge right now. What do I do? And she sends me an answer, right? It saves me time. It saves her time from having to see me in person. Okay. So you can do progression adjustments. You can do programming adjustments. You can have, if they have a flare up, they can come in and get a session. You can have return to activity guidance. You can have all of that. And this is more, it's a 6 to 12 month transitional program. This is a huge care management. So you can have 6 months options, you can have 12 months options, you can sell them in 4-month increments. This is for people who want someone helping them make decisions as their body changes. So again, think a birth plan, postpartum, someone training for a marathon, someone recovering from a marathon, all of these things, right? So one of the reasons I like this tier is because you still have one-offs, and that protects trust. If people want to start with a one-off, that's a really great way to be like, no problem. We can go 1 session at a time. That's great. Those individual sessions are usually priced a little bit higher than the care management sessions, okay? The guided recovery, where it's a short increment of time, 3 months, is something that feels familiar to them. Like, okay, 3 months, it has a distinct endpoint. Not everyone's going to benefit from that, and that's okay, right? And then care management becomes a choice that they have, not necessarily a push into something, okay? It becomes for them, oh yeah, I want this. I want to feel better for this. And then you price it accordingly. So care management is not the only answer. It's just a value add, right? And you're not packaging it. Again, get away from a time for money model. It's 12 sessions at an hour session. No, we're going to schedule these sporadically. You get anywhere from 6 visits to 12 visits, or maybe in the care management team, you get anywhere from 2 to 4 visits a month, depending on what you need. They can last anywhere from 20 to 45 minutes. It's more just what you need versus trying to fit a square peg into a round hole. It saves you time and money in the long run, and it prevents flare-ups from happening, because usually if a flare-up happens while you're in the care management program, we will be able to work on that and address that in real time, right? So they feel supported, they have access to you for questions. And so it really builds out. And when you can build it out in a visual for people, they will most likely lean into one of the care management programs versus just a specific amount of sessions. Okay. And they don't have to pay everything up front. You can offer a discount if they pay it up front, but you can also, they can pay monthly, right? Which lowers the barrier to entry for them a little bit. So I think if physical therapists specifically can learn how to stop selling visits and start selling value, it will dramatically change the outcomes, not only for our patients and our clients, but for our industry as a whole. And it stops this whole feast and famine cycle. And I really think it might be a way for you to help your team learn how to sell this transformation a little bit better rather than one-off individual sessions or packages. That's my feeling. I'm here to try to help people make this transition with their patients and clients and bring it more into your messaging and whatnot. And I really think it would be a huge value add for our profession as a whole moving into 2026 and beyond. So I'd love to hear what you thought about this episode. You can always DM me over on Instagram. Let me know, do you do this in your practice already? Is this how you sell? Do you have hesitations about it and what those hesitations might be? I'd love to hear from you. DM me over at Christa Gurka on Instagram. And until next time, my friends, bye for now.